Welcome to the Red Clinic Podcast. I'm Dr. Schwalen, licensed psychologist and expert in the treatment of eating disorders. Last week, we talked about school lunch. So if your child is in eating disorder recovery, how to navigate school lunch now that the school year is back in session. This week, I want to touch base more about being back in school and trying to manage an eating disorder. So instead of talking about eating at school, I want to talk about just social peer influences at school and how that may or may not be affecting your loved one who's trying to stay in recovery. There are so many things that come up during the school year. For middle school, high school, even elementary school, I see it all the time in the Red Clinic. And so I just want to put this on your radar, parents, and support people out there as you're trying to navigate the school year and maintain recovery from an eating disorder. One thing that really comes to mind a lot are the social pressures in terms of just fitting in. Your child is up against trying to fit in, trying to make sure that they are conforming to what's acceptable, trying to find an identity. And in fact, that could have been the reason that the eating disorder found a way into your child's life in the first place. And so now trying to navigate, staying on a meal plan and leaving class early to go to therapy sessions and all of that may make them stand out even more than they want to, right? Makes them even more different than they were hoping, and they may have to process that. So please just be aware of that yes, we're trying to prioritize recovery and keep your child from relapsing, which means very intentionally following a meal plan, maybe doing it in a way that they're not accustomed to because they're not eating in the cafeteria for whatever reason, leaving school early for appointments, and always just kind of having to explain to their friends why they're leaving or what's wrong with them, or things like that do come up. So make sure you're giving space to your loved one to be able to talk about those things and process how to respond to those types of questions with your therapist. Other things that your kids are facing, especially if they're an athlete, are body image issues, right? There are so many sports out there, even in the school setting, that, I think maybe intentionally or unintentionally, I'm going to go with unintentionally. I don't ever think it's a coach's intention or a team's intention to body shame, or make someone feel like they're less than just because they look a certain way. But it's absolutely happening, okay? So I think it's out there that appearance or sports uniforms, kind of contribute to some of this in sports like gymnastics, volleyball, dance, swimming. I see it in wrestling for young men, football, track. I see it in track all the time, cross country, pretty much any sport, right? Anytime that there are pressures to perform at certain levels, coaches who want to take their team to state, there's a lot of pressure to be faster, be leaner, be stronger. There's also a lot of pressure that peers will put on each other, especially amongst young female groups. So I know a lot of young females who come in with eating disorders who will talk about how they just knew that they were different than the rest of their team. Maybe because they felt like they didn't fit in with their athletic ability, or how fast they were, or how high they could jump. And so they turned to taking out that disappointment in themselves onto their bodies. So that's where body image can really play a big part. I also hear athletes tell me all the time that their coaches may not have intended to maybe send them towards having an eating disorder, but whatever messages they were getting from the coach absolutely promoted that. So there are a lot of coaches out there who may ask their athletes to be on certain diets or promote certain meal plans, right? And they're not doing it thinking I'm going to eventually trigger an eating disorder in this student. They're just doing it because they're using their knowledge as a coach to help their athlete be the best that they can be. And so those are things that if you are catching wind of it or concerned about it in any way, absolutely communicate to the coaches. Let them know that your child is in recovery, that if they have any kind of meal plan advice or nutrition advice, that you would prefer that you consult your own dietitian, given the fact that your child is in eating disorder recovery. Now, how to navigate some of those social pressures. Your child may not feel like they fit in on their team, that they're good enough, or they're just comparing themselves to other athletes, right? If that's the case, make sure that your child is bringing that up in therapy. Make sure that you don't turn a blind eye towards it. Just show your child that you know that it's happening. Or even if you don't know it's happening, you're guessing it's happening, right? Like it's more likely it's happening than it's not. And so I just want to put that on all the parents' radars out there, that if your child is in high school or junior high, it's happening. Okay, that's just kind of the environment that they're in. So there's that issue. So there's the being an athlete, wanting to fit in, and their identity now that they are in recovery. Another question I got, and it's really common actually, is, are eating disorders contagious? And so a lot of times if an individual, maybe it's your child who's trying to get into recovery, stay in recovery, if their friends find out that, they have an eating disorder, or their friends' parents find out that they have an eating disorder, your child, the one who does have the eating disorder, may have to deal with either being rejected or ostracized because of it. Some parents out there do believe that it's not a good idea to have their children around someone who has an eating disorder. They also may worry that, that person could negatively influence their child. And so that's tough. It's hard, right? We can't always predict how people are going to react. Nowadays, though, I will say that there's a lot less stigma around mental health and eating disorders, that if people find out, especially if they're your child's friends, that there is an eating disorder or your child is in recovery from one, they're more willing, what I've seen just from my experience, to step up and help. How can I support you? Is there anything that I can do or that you need from me? How do I know when it's getting to the point that I need to tell your mom or get you some extra help? That's usually what I'm seeing. And this fear of eating disorders being contagious is not as common anymore, but it's still a question that comes up. So to answer it, I'm going to say, no, eating disorders are not contagious the same way that maybe the flu or a common cold is, right? There are, however, little communities that have formed on social media and just online that are considered to be pro-ANA or pro-MIA. Okay, so that's pro-anorexia, pro-bulimia, where you can literally go online and type, how to be better at an eating disorder, or how to get a flatter stomach, or how to just improve my skill at purging. Like, how do I make myself vomit, right? So there's absolutely a ton of information out there on how to be really good at an eating disorder. There are individuals who are going to study those websites and try to, essentially get good at an eating disorder. That doesn't necessarily mean it's contagious. It just means that maybe that person had the propensity towards developing an eating disorder, and now they're really into it, right? Because it's a part of what they're going through. There are sometimes when someone has an eating disorder and it can influence another person by way of, you're on this diet or you don't eat lunch, maybe I should try that. But usually, if there's no propensity towards developing an eating disorder, so if those biopsychosocial factors are not in place, and I've spoken about those on previous episodes, the person who's trying it on for a little while is not going to last very long, okay? So even if an individual is trying it on and just kind of seeing what is it like to have bulimia or anorexia or restrict or go on this diet for a really long time, if they're not truly an eating disorder patient, they're not going to succeed at it. Not for long anyways. And so that's why the answer is no. Eating disorders aren't really contagious. There can be an influencing factor there for someone to maybe try it for a little while, but then realize it's not for them. And then it can go the other way, where, like I said earlier, the person with the eating disorder can be ostracized or rejected. And so that could be the reason why people don't want to be around the person with the eating disorder. And so I've seen it just both ways. And you have to be aware in your child that in this world that they're living in, if they're open about it or they're sharing with others that they're in recovery, there's going to be some things that they're going to go through, just depending on how other people react to it. These are all conversations that you should be having with your treatment team so that they can help support you through it. This is what it means to be in true recovery, to go through the daily challenges and just the basic hardship that comes with it and overcome them despite having an eating disorder. So there you have it. That's Sort of Clinic Podcast. Thank you so much.